So now, the fun part of the day. It is my great pleasure to introduce our keynote speaker, Bonnie Wattles. Bonnie is the Director of Hilarity for Charity, or HFC. Her extensive background in business and nonprofit leadership is taking Hilarity for Charity into its next phase of growth, providing care and support for families impacted by Alzheimer's disease and activating the next generation of Alzheimer's advocates. That's you all. HFC is driving innovation in brain health education and disease prevention for young people, and it has become the largest provider of free in-home respite care nationwide. It offers a robust selection of virtual, professional-led support groups and caregiver wellness programs, with over 1 million people engaging with its online community every year. Bonnie hails from Hamilton College and Columbia University. Her work with dementia is in memory of her grandmother, Sadie, who lived with dementia. So without further ado, I introduce Bonnie Wattles to you.
Hello, hello. How is everybody today? All right, let's see. I have my slide here. Perfect. Well, it is so nice to see you all here today, and it's an honor actually to be here, and I want to thank George Worthington for inviting me, the Virginia Alzheimer's Commission, and a special shout out to my good friend Dr. David Goldberg, who's not here. He's from VCU, but he's also Hilarity for Charity Associate, so thank you for having me here today. You've already heard I'm the Executive Director of HFC. I've been here for about 5 years, and Lauren and Seth have been in this work for over 10 years. Today's session is so exciting to me, and I hope to you, because you all have the opportunity to have input into Virginia's next dementia state plan. What an incredible moment to pause and celebrate all of the collective expertise in this room and your body of work, and you get to inform the next phase of the Virginia State Plan with the goal of becoming fully dementia capable. I really applaud your efforts to add brain health education and dementia risk reduction into the plan. This is such a crucial step in changing the trajectory of the disease, one that our organization, Hilarity for Charity, shares with you as part of our mission. And I might interchangeably say HFC instead of Hilarity for Charity because it's a mouthful. But before we chat more about dementia and HFC's work, I'm hopeful that this presentation will be somewhat interactive and maybe even fun. My goal is to share some of the data, but also to generate conversation about our innovative and some might think irreverent ways to approach solving this crisis. And I'll give you a hint. It has to do with dementia not being an older person's disease. Give me a minute here. Okay. So let's frame the problem. More than 1 in 9 people age 85 or older, I'm talking nationally outside of Virginia, more than 1 in 9 over age 65 have Alzheimer's, 1 in 2 over the age 85 has dementia. That's more than 6.5 million Americans and 50 million people worldwide. And these numbers are on the rise. In fact, they're expected to triple by 2050. And what this chart is showing us is from 2000 to 2019, Alzheimer's deaths have increased 145%, while deaths from other diseases have been on the decline. It's pretty staggering. The disease impacts some more than others. Women are twice as likely as men to receive a dementia diagnosis. Older Hispanics are about 1.5 times as likely, and older African Americans are about twice as likely. By 2040, nearly 40% of Americans living with dementia will be African American or Latino, and the Asian American population is also disproportionately affected. Asian Americans age 65 or older account for more than 8% of ADRDs, and we know that they are experiencing a significant rise in deaths. We also know that people of color are less likely to receive a timely diagnosis, are more likely to experience discrimination in the patient or caregiver journey, and are less likely to be enrolled in clinical trials. There's a tremendous cost to dementia in America. These numbers are a little out of order, so just bear with me. The total cost of caring for somebody living with Alzheimer's and other dementias is projected to reach $345 billion. That number does not include the $340 billion estimated for the price of unpaid caregiving. Medicaid and Medicare cover only about 64%, and out-of-pocket spending is expected to be $87 billion, or 25% of total payments. If we drill down to an individual family level, nearly 8 in 10 caregivers report having routine out-of-pocket cost expenses related to looking after their loved one. And a study done by AARP in 2021 reports that that's about $7,200 annually per person. Without significant advances in treatment, dementia is projected to cost the United States more than $1.1 trillion by 2050. 2050 is only 26 years from now. If you feel like that's a long way out, I think we need to ask ourselves how long ago Harry Potter was published. When did Tiger Woods win the Masters for the first time? Or when we saw Titanic in movie theaters? Yes, all of those 26 years ago, so not that far away. Not only is dementia one of the fastest growing health crises of our nation, it affects the whole family. Family members, caregivers, care workers are extremely burdened by the physical, emotional, social, and financial toll that comes with caring with somebody living with dementia. I also like to note that our healthcare system puts so much of the responsibility of this disease on the family. Children of aging parents and their siblings have so much to think about navigating the healthcare system with their loved one and what caregiver roles might be necessary now and in the future. Caregivers are learning as they go without any formal education. And what we're seeing at HFC is that family caregivers are overwhelmed and underprepared for the caregiving journey. They're often part of the sandwich generation, caring for an elderly parent as well as children and having a full-time job. It's more like they're the panini sandwich generation because they're being pressed from all sides. Much like climate change, economic inequality, and other great challenges, it's the younger generations who will bear the burden of our inaction today. However, at HFC, we believe that the younger generations will be a big part of the solution. And while they're not here today, I don't see any young people here today, perhaps their voices could be incorporated into the state plan at some point. It was the absence of young voices in the Alzheimer's and dementia space that inspired Seth and Lauren to found Hilarity for Charity. Okay, so all that depressing news is over. Here they are. Seth is an actor, writer, producer, and director. This year you can see him in Steven Spielberg's The Fabelmans, or maybe you took your kids to see Mario Brothers movie in which he voices Donkey Kong. If you've been around for a bit like me, you know him from Superbad, Sausage Party, and Pineapple Express. He is an entrepreneur, a best-selling book author, and an impressive potter. Yes, pun intended. Lauren is also a filmmaker in her own right, and I never like to say Lauren, Seth's wife, because she really is very accomplished in her own right. She's a writer and producer. She directed films like the recent Like Father, starring Kelsey Grammer and Kristen Bell, and I'm pretty sure you can still see that on Netflix. This is their mom. This is Lauren's mom, Adele. When Seth and Lauren were dating, both in their mid-20s, Lauren's mom was diagnosed with early onset Alzheimer's. She was 55. Seth and Lauren were at the beginning of their relationship and promising careers and utterly unprepared to face the looming family crisis that would be the backdrop of their lives for the next 17 years. Lauren spent many of those first years feeling sad, angry, and hopeless. As her peers were getting married, starting their own careers, starting families, all with their own parents looking on, Adele was slowly losing her ability to speak, feed herself, use the bathroom, and walk. When Lauren finally gathered the courage to seek community and attend a support group, she found that she was the youngest participant by far and the only one who wasn't caring for a spouse or an elderly parent. She didn't feel there was a place for her, her grief, or her unique set of challenges she faced as a young caregiver. Despite a profound sense of isolation, both Seth and Lauren's careers were taking off. Almost immediately upon gaining a platform, they started using it to tell young people how dementia was not an old person's disease. They knew as young people themselves they had a unique power and perspective to change the narrative. They did this by channeling their heartbreak into what they knew best, comedy. They often say if they were bakers, it would have been called baking for charity. They hosted variety shows, adult proms, costume parties, and made every effort to create spaces for young people to feel supported and to say, let's kick Alzheimer's in the Ballsheimer's. It sounds so much better coming from Seth. You're going to have to listen to me for a bit longer, but I will let the work speak for itself.
Hello, human. You are receiving this as a special plea from me, Seth Brogan.
Hello, it's Lauren from HFC.
My wife and I started Hilarity for Charity to bring much-needed awareness and funds to fight Alzheimer's disease.
My mom, Adele, was diagnosed with Alzheimer's at 55 years old. We spent a couple years feeling as we should, very depressed and angry and just completely hopeless. And then we realized, oh wait, we have a voice that we could use. And so we started throwing variety shows and created an organization.
It's going to be a wonderful night.
What the fuck are you guys doing here?
Seth. Welcome to Hilarity for Charity.
We're at the Hilarity for Charity County Fair.
A special, one-of-a-kind experience.
It's the biggest, best charity special in the world.
You've tried to take a different approach by laughing, comedians.
It's all we know.
A friend once described Alzheimer's to me as a real you from the universe.
One day you can wake up and not know who fuck you are.
BK Subban! Bruno Mars!
We're here for a good cause. Enjoy yourself.
People come to our events, of course, to laugh and be entertained, but they also are looking for, a way to find some hope in Alzheimer's disease, which is often a pretty dark disease. And I think we like to think of these events as a way to sort of, laugh in the face of that.
Thanks for doing the show, Mindy.
Yeah.
Thank you so much. Rob Riggle, everybody! Yes! Thank you all for coming. Good night.
People need more help. It needs to be yelled and screamed to the point that it finally gets the attention and the funding that it deserves and needs. Well, now it's your chance to do something about it.
Together, we can shed some light on Alzheimer's disease.
Kick Alzheimer's in the Ballsheimer's.
This is something we all need to jump in on.
As much as we've accomplished, this is only the beginning, and there's still so much more work to be done.
And with all of that, there's more to be done. We still throw a fabulous party, but today we're providing thousands of hours of free in-home care for families who have a loved one with dementia. We run 31 virtual support groups led by licensed facilitators, an array of caregiver wellness programs, the most notable of which is our annual CareCon event, featuring celebrity-led panels designed to educate, inspire, and empower dementia family caregivers. I'm going to talk about this in a little bit, but we also lead a national effort to educate young people about brain health. We fund the latest technology and prevention-focused research and advocate for public policy, especially around care. We reach 500,000 people a year through our events, social media platforms, and press appearances. And we do this all with science and innovation and while maintaining our signature irreverence. As you heard earlier, this is an exciting moment of innovation and forward momentum for the field. There is tremendous hope in the space with multiple disease-modifying therapies in the pipeline, blood-based biomarkers, eye scans, auditory testing that will help us detect dementia, and a multitude of device and apps that will help us detect earlier. I've just returned from the Milken Global Conference where I heard so much about the future of longevity and increased lifespan and health span. So yes, the future of dementia is not as dark as it once was. With all this hope and promise, we find that there are many misconceptions about dementia, so please indulge me and let's get into some fun here with a short true and false game. All right, first question, you can all just scream it out. False. Correct. We know that Alzheimer's and dementia are not a normal part of aging and that prevention is absolutely possible. One of my favorite advocates in the space, and if you don't know her about her, I'm happy to share her work with you, is Dr. Annie Fenn. She has a brain health kitchen, and she says prevention is the cure. Prevention is the cure. Okay. Next one. Plaques and tangles. True. Okay. According to perhaps you'll learn more about this in the next talk, but Dr. Rudy Tanzi tells us after about 40 years old, we all start to build up the initiating pathology of Alzheimer's disease or dementia, which is the amyloid plaque and the neurofibrillary tangles, just like in the way we build up plaque from cholesterol, which leads to heart disease. Anybody? True. That means that in the case of Lauren's mom, the time for her to focus on prevention would have been in her early 20s. True. That's why we're here today. HFC is 100% committed to educating young people about taking care of their brains. And the last one. Correct. We heard earlier as well. It's never too late and never too early, and we can certainly delay cognitive decline by adopting our healthy lifestyle choices, really at any point. All right. While some risk factors for dementia, such as age, family history, genetics, cannot be modified yet, there are several factors that can be. And you can see here, physical inactivity, unhealthy diet and saturated fats, sugar, processed foods, smoking, high blood pressure, diabetes, obesity, hearing loss, and excessive alcohol consumption. And we can improve our brain health by increasing, having a healthy diet, exercising, getting good quality of sleep, which I am not that good at, and taking care of our emotional well-being. So I keep talking about young people, and you might be asking yourself, if you have teenagers or young adult children, you may be sitting here thinking, there is no way that they're going to take a deep interest in these factors or in brain health. I have 2 college graduates who also engaged in a lot of brain unhealthy activities when they were in college. They're getting better. But we did a survey amongst students last year, and we were surprised to learn that 72% of students reported that they were interested in learning more about brain health and dementia prevention. To that end, HFC's brain health education includes a focus on 5 behavior modifications: sleep, nutrition, emotional well-being, physical exercise, and cognitive fitness. And here's a quick Brain Health 101 as taught by HFC. Sleep allows our bodies and mind to heal and organize themselves in preparation for another day. Think of sleep as the night crew that cleans an office building so that the work the next day is unimpeded by yesterday's paperwork, those muddy footprints the mailman tracked in, or the leftovers Kevin always leaves in the break room. A clean office is a productive office, and a rested brain is a productive and healthy brain. Remember, when it comes to sleep, quality is just as important as quantity. And Lauren always says it's really free to improve your sleep. So it doesn't cost us anything to try to improve our sleep, and there's some tips up there for you. Next up is nutrition. We know we need to eat well. But did you know that of all of our organs, our brains are most easily damaged by a poor diet? Enter the MIND diet. I'm sure a lot of you have heard of the MIND diet. It stands for Mediterranean - Intervention for Neurodegenerative Delay. DASH stands for Dietary Approaches to Stop Hypertension. All of that is less important and far more complicated than the diet itself. To put it simply, the MIND diet is a blend of 2 diets proven to support brain health. Mostly think a lot about leafy greens, whole fruits and vegetables, whole grains in moderation, lean proteins, and healthy fats. So I just need to tell you a little bit about alcohol. This is the part where you don't like me, but alcohol is really not good for our brain health. I hear differing opinions on it. A lot of people say that, red wine is good for your brain health, but what I heard last week at Milken is the rule of thumb is about 4 drinks per week, but really limiting your alcohol intake as much as possible is the healthy way to go. And emotional well-being. Okay, I know we all know this. I need the reminder, stress is really bad for us. A short practice of mind-body therapy can help us build dementia-resistant brains. And I was so happy to see on your agenda today, you have a social break where you get to meet new people, and you have a physical activity break where you get to walk around the lobby. So bravo for incorporating brain health into the conference. And finally, exercise. Oh, nope, this is the second to last one, exercise. There's a lot of science behind what exercise can do to maximize brain health benefits. Every individual is different, so you have to determine what's best for you. But we like to talk about HIIT, or what's otherwise known as high-intensity interval training, which is short, intense periods of exercise with rest in between. And there has been research that shows that HIIT has a positive effect on the brain's neuroplasticity. And walking. If HIIT sounds overwhelming, we can start simply by walking. A recent study found that older adults who took 9,800 steps each day were 50% less likely to develop dementia as a result. Those who took 3,800 steps daily saw a 25% reduction in risk. And so again, we can all walk, and that's free. And speed matters. Apparently, if you walk faster, it's better for your brain health. But in general, the guideline is to shoot for about 150 minutes of exercise a week that gets your heart pumping. Cognitive fitness. It's like exercise, but for your brain. One of the best ways is to teach your brain new things. Active learning improves memory, creativity, mood, and self-esteem. Incorporate learning into our daily routines, such as reading, taking courses, or trying new hobbies, keeping our brains active and engaged. This is one of the most powerful ways to delay the onset of cognitive decline. And Lauren and Seth, during the pandemic, took up pottery. So they make pottery, and now they're making glazes. So that's how they spent their time in lockdown, learning new things. I do have a myth buster for you. Crossword puzzles are not the best exercise for our brains. They're great for improving our vocabulary, but they're too passive and repetitive to stimulate the brains the way we would if we were learning something new. Apparently the same for Sudoku, which is my favorite. All right. It's not that they're bad. You can still do them, but so here's where I'm going to talk about the young people. So how are we teaching young people all of this great information? So I'm pleased to share 3 of our most innovative programs. First, we recently launched HFC Universe, which is a comprehensive digital platform featuring brain health and disease prevention curricula for high school and college students. These courses are taught by celebrities and based on the groundbreaking research led by Dr. Richard Isaacson. He's a neurologist and the founder of the Alzheimer's Prevention Clinic at New York Presbyterian Weill Cornell. HFC Universe is the only nationally distributed prevention program for teens and young adults. Since its launch, HFC has educated thousands of learners, and last year was recognized by Fast Company as a world-changing idea. I think we have another video.
Hey guys, Professor Seth Rogen here. If you're in college or high school, stop scrolling and listen up. Hilarity for Charity has now teamed up with a team of doctors and researchers at New York Presbyterian and Weill Cornell Medicine to develop a scientifically based course on Alzheimer's prevention, specifically for students like you. We need your help to improve brain health for you, your family members, your friends, and people you may care for who are affected. I'm your professor, and class is now in session. Nothing worse than fake laughing. This is how we make movies. It's exactly like this.
We put that on social to incentivize students to take the coursework. And his laugh, that is legitimately his laugh. So true story, the coursework was the result of a research study we funded with New York Presbyterian Weill Cornell in 2018, I believe, that provided students, that proved students are more likely to watch and retain medical education delivered by celebrities than by actual doctors. The study was published in Neurology in 2020. I know, it's crazy. Through this education, HFC aims to achieve these 4 goals. One is to change the conversation, empowering our young people to talk to family members and generate that conversation, increase brain healthy habits, and reinforce that dementia is not inevitable, reduce the stigma, which we all know exists, and provide detection education. How do we know the signs and symptoms? In 2023, we're going to launch 5 new celebrity-led courses, each specific to one of our brain health habits. We've already filmed episodes with Chloe Kim, she's an American skateboarder, 2-time Olympic gold medalist, and Maitrey Ramakrishnan, who plays the lead character in the Netflix teen comedy series Never Have I Ever. We're also excited to announce, I'm so excited to announce, that we have Quinta Brunson and Kristen Bell, who are going to be filming courses shortly. And we're working on recruiting a 5th celebrity, so I'm open to suggestions. Oops. I'll play this also. And that was Dr. Isaacson in the background there. All right. Our second innovative approach involves our recent acquisition. After many years of partnership and mission alignment, HFC officially acquired the Youth Movement Against Alzheimer's, or WIMA, as we like to say, to our suite of youth-driven programming. Founded in 2015 at UCLA, WIMA is a growing community of over 600 high school and college students across 31 chapters in 16 states, committed to raising awareness and changing the trajectory of dementia. Since its inception, WIMA has been mobilizing students to take action, engage in advocacy, awareness campaigns, and community service. WIMA members have gone on to medical school, neuroscience research, and gerontology, and continue to lead the way. The merger accelerates a key tenet of HFC's mission to activate the next generation of advocates. It also deepens HFC's youthful niche in the landscape and allows WIMA's nationwide network of students and young caregivers to scale with the support of HFC's organization and brand. Our 2023 plans include developing a brain health peer education program so that students can become HFC certified brain health educators. Students in the program will also benefit by leadership training, scholarship opportunities, and tailored support for caregiving youth through our respite and caregiver wellness programs. Our third program includes our partnership with UC Irvine Institute for Memory Impairments and Neurological Disorders, or UCI Mind, to invest in emerging leaders by encouraging students to explore the field of neuroscience as they move from year 2 to 3 in medical school. Over the past 3 years, we have sponsored 15 students. Many of these students joined us at our recent signature event in LA, and they got to show Seth a real brain. He was pretty grossed out by it. So as I come to a close, I ask you this. Is it possible that the future of dementia is powered by brain health prevention and youth? At HFC, we are incredibly hopeful that education and prevention intervention may one day lead to a world without dementia. It's a world I know we would all love to live in. Virginia's Dementia State Plan includes wonderful plans for public health education and brain health awareness. As you work through the next phase of the plan today, I encourage you to consider these questions. Can we integrate youth and brain health education as part of Virginia's plan? What partnerships and resources are necessary to achieve this? Can we consider adding to the state plan the incorporation of HFCU's coursework? Maybe even get it into middle and high school curricula. We would love to pilot that with a state. Would it be possible to have every high school and college in this area have a WIMA chapter? I leave you with this quote from Maria from Downey High School, one of our WIMA students, reminding us again that dementia is not an old person's disease. Thank you so much. And I think we're taking some questions. Is that right, George?
I've got a microphone if you want to raise your hand.
Hi, thank you. I wondered in your third program with UCI, I wondered if you'd given any consideration to encouraging students to go into the field of geriatrics in addition to neuroscience.
We absolutely are interested in expanding this program beyond UCI Mind. We're reliant on their researchers and what research they had going on and what students were interested in, but we are looking for other educational institutions to perhaps expand this, and I agree, we need to have students track to gerontology.
Okay, thanks.
I want to ask, of course, we still have a huge drug problem here in the United States. Is there any credible research or that connects Alzheimer's and dementia with possible those individuals in the using of drugs, which of course became quite prevalent, say in the mid-60s and onward? Is there any evidence to that?
Yeah, I haven't read anything about that. We often get asked the question, is smoking cannabis related to, is it good or bad for dementia and Alzheimer's? And the fact of the matter is it just hasn't been studied enough. I'm not a scientist, but we tell people that if you're underage, you should not be doing drugs. Seth is the first person to say that, but I do think more research needs to be done in that area. It's an interesting theory.
Here's a tough question. Tell us a good joke.
I'm the least funny person. I'm sorry.
So have you met Seth?
Yes, of course, yeah. He's, I'll just tell you a little bit. Him and Lauren, sorry? Where is he today? Today they're in LA. They live in LA. They're both incredibly accomplished individuals. Seth works harder than anybody I know, despite his public persona of being like a lazy stoner dude, which he says. But they are, as hard as they work in all their other endeavors, what I find most admirable about them is that they are 100% committed to this cause. They give us a tremendous amount of time. They both spoke at the Milken Conference. They do a lot of virtual events. I'm on the phone, we're on Zoom now, every week with Lauren going through all of our programming, all of our communications. Seth is usually walking around in the background. He hears everything, just so you know. He may not be like right on Zoom with you, but he hears everything. So they're both incredible, and they're both incredible on stage, and so we use them a lot to help us spread the word and try to change the narrative around Alzheimer's and dementia.
Yeah, can I just add that if you do a search, I watched an interview with Seth and Lauren with the Washington Post telling their story of how they got into this, and it's really moving and wonderful to hear. So I encourage you to find it.
Yeah, I'll also add to the video of Seth speaking to Congress. I think it was in 2015, maybe. That has been viewed millions of times, and that's what went viral and helped them realize that they really had an audience, but it's funny and poignant.
So I work mostly in low-income communities and with veterans, and one of the things that is so heartbreaking is that we can tell them about how healthy they're supposed to eat, but the food banks are providing food that fills them up. And they repeatedly say to me, I know that you're telling me to eat whole grains and leafy vegetables, and I can't access that food. Is there anything that HFC can do to help educate food pantries and the people who are donating to food pantries?
We certainly can look at that in the future. We agree, we know that's a huge problem. We know that the 5 brain healthy habits can be interpreted as difficult for people in lower income communities to really adopt. And we know that there are food deserts, but that's a really interesting way is to approach it through the food bank. So thank you for that feedback.
I have a question back, I think it was the second program about students and certifying students. We have started funding internships through a few local colleges in Virginia to try and get people, get young people interested in working with older adults. So if we wanted to, or if anybody wants to incorporate some of HFC's curriculum or that certification into partnerships that we already have with schools, what would the first step be?
Yeah, that's a great idea. We are finishing up the curriculum development with Columbia Teachers College right now. And so when that is ready, we will be able to distribute it, which we're thinking will happen in the fall of 2023. So, George, will you be able to share my contact information, my email? And then if anybody is interested, you can follow up with me and I'll connect you to the programs team.
There's an intersection between intergenerational relationships, I think is the idea there. There's also an intersection in my mind of hearing about the youth movement, Alzheimer's disease, the underlying issue of ageism, old vice young, young vice old. And is this movement addressing that societal issue?
I agree. That was a huge topic at the Milken Institute conference last week about longevity and changing the narrative around aging or reframing aging. And some people even thought we shouldn't even be calling it reframing aging. It's just rebuilding. Like we just need to start over and just celebrate everybody at every age. It is something that we can continue to work on, and certainly how we speak about it to our students. I think it's going to be an evolution over time. But thank you for sharing that.
Getting my steps in.
Thank you for a really inspiring talk, and thanks for sharing the videos. I participated in one of the CareCons, so I wondered if you could mention a little bit more about what that looks like when it happens. And I think for family caregivers, they can participate at a reduced cost or even free.
Yeah, CareCon is free to anybody, and there's, the platform allows thousands and thousands of participants. CareCon is an annual virtual event that we run on National Caregivers Day. I believe that's February 17th. I'm not sure what it is in 2024. And it is about a 2-hour virtual event, and we have panel discussions having to do with caregiving, reducing your stress in caregiving, comedy in caregiving, the financial, how do you navigate your the finances of dealing with somebody with dementia. And so they're all celebrity-led, and we have experts, and anybody can, join on. And so we always have that on our website listed. And if you follow us on social, we will very much announce it. Like, you'll get a lot of Instagram posts about CareCon and all the celebrities that we have in it, but it is free to everybody who attends. And interestingly, the platform that we use allows breakout rooms. So the second part, people can choose what workshop they want to go to. So it could be something, very specific, like, how do I create legal documents or a living will or financial planning, or it could just be like a meditation session. So I encourage you all to attend. Oh, and all of the videos for the previous CareCon that we just had in February are on our website. So if you go into the caregiving tab, you can rewatch some of the panels.
So a lot of this focus, and great, so excited that Seth and Lauren and you are providing these resources. Who living with dementia is speaking into your curriculum and part of your organization?
Yeah, so important to have the patient voice in everything that we do. As an emerging organization, we have some work to do there. So we are looking to add people living with disease to our main advisory board. We have people living with the disease on our care advisory board. That's the board that helps to inform the respite care program, the support group program, and some of our caregiver wellness programs. But we definitely could be doing a better job of it. There are other organizations that are really embracing the patient voice. We are one of our, I do believe, and I don't know if it's active right at this moment, but we are planning a support group for people living with the disease or newly diagnosed.
I know there are those tests, especially the utilizing of blood, to specifically identify various negatives or negative genes or whatever. Has there been any testing, those that do have Alzheimer's, whereby one can have these specific tests to say, yes, you do have the more than likely advancement of Alzheimer's or being challenged with Alzheimer's? Is there anything that has been done to possibly identify so an individual can know the importance of following the healthy approach?
I don't believe so. I'm not a scientist, so perhaps the doctor who's going to speak next can have a better answer. I know that the blood test that is currently in the pipeline has an algorithm that incorporates your age and other factors. So some are saying it's not necessarily a predictor, but there needs to be more work there.
Let me just say, as the brain guy, that there's an intense effort on biomarkers, more accurate, more easily obtainable biomarkers to early identify persons before they're symptomatic, and then do these intensive interventions of one type or another. In the world of dementia, biomarkers are the bomb. Sorry, that's a baby boomer thing. I should say if we're going to do intergenerational stuff, I should say biomarkers are not the bomb. Let's say they're lit.
Yeah, and hopefully you'll talk about eye scans and the auditory testing that's coming, which is really exciting, non-invasive ways to detect.
Were there any other questions for Bonnie? Well, please join me in thanking Bonnie for her inspirational and wonderful speech.
Of course, thank you so much.